There's a lot of excitement around this new treatment called Alloclae, and it's really kind of changing how we look at the non-surgical body contouring space. Can you explain to us exactly what Alloclae is?
Sure thing. Alloclae has really been a game changer in my practice, especially for non-surgical body contouring for both breast and buttock and hip dips. Tiger Aesthetics is the company that owns and manufactures Alloclae, and Alloclae is cadaveric, from a cadaver, from a dead person, fat that's been highly processed and made safe to inject in someone else. Now, a lot of patients and other providers are like, whoa, hold on. I'm going to get fat from a dead person? That sounds crazy. And it really isn't so. In medicine, in surgery, we use cadaveric products as replacements in our body for lots of things. Sometimes orthopedic surgeons will use it for tendon grafts. We'll use it in burn patients. We even use it in breast surgery with mesh. So this isn't a new thing in terms of being able to use cadaver tissues, take the living components away from them, and use them in our bodies without having any rejection or anything like that. Alloclae is different because what they do is they take something that's replacing like with like. You want to replace fat that's lost in certain areas, whether it's from weight loss, pregnancy, aging, etc. You want to replace it with generally the same thing. We try to find things that match the tissue types of what we're trying to replace. Nothing is going to replace fat better than fat.
Right.
Now, when it comes to Alloclae is produced, the adipocytes, which are the fat cells, they're taken from the cadaver and they're highly processed. The processing of that allows us to take the living components and the DNA and things that make it a person's product and turns it more into a foundational structure. Okay, so this is kind of like tissue engineering, where you provide a scaffold that is largely inert and doesn't have any living components to it, and then allow somebody's cells to populate that scaffold in whatever configuration you want. So I think that's how Alloclae really acts in terms of mechanism of action. What comes in a vial of Alloclae is something that kind of looks and feels like fat, but is really just the foundational structures of the fat along with some growth factors. And that induces your own body's fat cells to come populate that scaffold. And that scaffold really only lasts for a temporary period of time, because just like anything that's a foreign body that we're injecting, it's going to be metabolized by your body. But the nice thing is that the fat cells that have come and populated that will stay and remain and act like normal fat. So that's really the cool aspect of this as a regenerative product, because it is inducing your own body to populate this area and provide a home for those fat cells.
It removes the DNA fragments, which basically removes the human component of it. And
Correct.
in removing that, do we still have concern for an immunologic reaction or a host reaction?
We don't, because removing that DNA component and the living nature of it takes away the, let's say, the identity of that fat cell. So then your body cannot dictate, or your immune system can't go find it.
Brilliant.
I think it's really cool science, and I think the science sometimes gets a little confusing about this. So when I talk to patients about what options they have for buttock augmentation, I talk about it in the three main categories, which is one, liposuction and fat grafting of your own fat cells, which are living, into another area. Then we have the biostimulatory treatments like hyperdilute radiesse or Sculptra, which cause fibroblast reactions in different ways to produce collagen, which the mechanism is that that collagen then will give volume in that area. And then the third option is Alloclae. The other thing is you don't have to baby it in terms of recovery options. So Alloclae, because it's not alive, you don't have to worry about, am I sitting on it too long? Am I going to cause death of this fat cell that was transplanted that's already stressed out? It's hard to kill something that's not alive. So my patients also don't have restrictions when I use Alloclae as an injectable, because they can literally get on a flight and go home the same day, and they have no restrictions. They're back to exercise the next day. That's amazing. I think the last thing is you need to have a lot of donor fat available to be able to inject fat, and you have to inject more fat than you think you need, because you have to predict for this fat graft survival take in the buttock area that you don't know whether it's going to take or not. So people over inject to try to see how much will go. So you need a lot more fat donor-wise to do so. Well, guess what? In our kind of GLP and peptide community that we have now, we don't have a ton of donor fat for many
So
patients.
true.
And certainly not in my patient population that I see, where we have people that come with a ton of fat that I can take and harvest and use for fat grafting as it is. So the whole discussion about fat grafting sometimes is a moot point because you don't have any
Not
to
an
graft.
option.
So then we don't have any options for you other than Alloclae. And I think that's why this is taken off, because so many patients are devoid of donor fat and then they're losing fat in areas that they want fat. So how do we replace those areas? And Alloclae is the answer for us.
Can you speak on your experience as far as the retention that you see long term?
Tension that we're seeing with Alloclae is nearly 100%. If not,
Wow.
sometimes it fluffs up a little more. People, we talk about with users of Alloclae, and I think that fluffing up more component occurs because that scaffold then populates and fills up with living fat cells. And so we're getting a little kind of boost, and the people I've injected in their buttock areas, they've found that they at least maintain the same amount, if not, they get a little touch more. Now, in some of the animal studies, they're showing an 80 to 90% rate at 6 weeks of take. And I'm sure they're being very conservative with the measurements. And those are data points that will be coming from the company. But I'm not seeing a lot of loss of fat graft take, both in the breast and the buttock area where I inject. Now, because it's your native fat, if you undergo fat changes, I think it will similarly undergo fat changes. So if you're continuing to lose weight on GLPs or peptides, I think that will affect how much will be take in the end, because it's your own fat cells. And if you're losing fat from everywhere, you'll probably lose fat from this area too. I'm sure those are studies that'll be really interesting to see. So yeah, I think it's really exciting. I can do it in the clinic. I don't have to be, the patient doesn't have to undergo anesthesia. They can literally fly in and fly out the same day for this procedure. So it makes it very convenient for patients rather than undergoing a surgery and anesthesia for fat grafting. It holds
Yeah.
its shape.
That's
And
so cool. I love
that
it.
is pretty amazing. This is it comes in different cannulas. So it comes in a kit that's ready to use for the clinic. So you don't need special materials. And it comes out in a big cannula because they want to maintain that rheology, that push characteristic of that product. If you start putting it through a small needle, you're going to change the characteristics of it, putting it through a very small bore diameter.
Mm-hmm.
And for that larger piece to go through and maintain its shape, you're just going to liquefy the thing and defeat the purpose of it. So they actually, I think they smartly thought about, well, how is someone going to use this and say, hey, we don't have efficacy? Well, if we can't control the whole way that it's injected, then someone's
Right.
going to do it the wrong way, change the properties of the product, and then say it doesn't work. In
Right.
this way, they provide these, they come in little boxes, the different and they have different tips on them depending on the use that you're using the Alloclae for. But I think that's really smart to
Mm.
control, and they know what's in here is the same thing that's coming out the tip.
On average, how many syringes would you say you're using for something like a hip dip? And would you say if somebody wanted to come in truly requesting volumization in the buttock?
I think another great aspect of this treatment is that you can do it multiple times. So you can start conservative. Now, you don't want to start so conservative where you see no result and you kind of give up on, you said, I spent a ton of money and I didn't get a result. So I usually tell patients about 50 cc's per area that they're
Okay.
trying to treat is a great starter dose. So if we're doing hip dips on both sides, sometimes they're more severe than others, but I say, why don't we start with 50 to 75 cc's on each side,
Mhm.
and that will give a meaningful outcome. So that will give you a meaningful improvement in shape. And then if there's other areas we want to treat, then those will be 50 to 75 cc's as well. So we think about the upper shelf as another area someone wants to build of the buttock, or overall projection. So, I don't want people to think it's this thing that they can just blow up the butt and make as big as possible. It's really for targeted volume improvements and contour improvements. So we usually focus on one at a time. Usually it'll be, let's do hip dips and then focus on the upper buttock. Or if you want to do a little more for my fly-in patients, we can focus on two areas and then see how and distribute it across. And what I usually do is I inject about 75% of the product, and then I allow the patient to stand up and see where the other areas we'd like to deposit the last 25% are. So maybe we've achieved our goals in the hip dip or procedure for my patients
Mhm.
because I numb them up and then I use ultrasound to inject it for the buttock. And even in the breast, I use ultrasound as well. And then they're able to participate. We do it sterilely because it is a foreign body I'm injecting. So I do think it needs to be done in a sterile fashion. But it's nothing you can't do in your clinic as long as you have the ability to do a sterile procedure.
Can you walk me through the risks when it comes to Alloclae? We always love the upside, the beautiful results, the sunshine and roses, but there's a dark side to every treatment
Sure.
that we offer, from neurotoxins to fillers to whatever threads. So, what are the risks when it comes to Alloclae?
So I think when we think of short term, I think of just the procedural related stuff like bleeding potential or pain from inadequate numbing to place this product, and mostly bruising that happens afterwards. That can be a little painful. Certainly, if you don't do it sterilely, infection is one. It is a foreign body that you're putting into somebody, so you have to do it in a sterile fashion. So I think that should be done for a lot of fillers. I think it's maybe not so stressed on dermal fillers, but if we think about when people get granulomas and capsule formation around different types of fillers, are we really blaming the filler or is it the technique that is placed? What we know from breast implant literature, which is another foreign body we commonly place, that how you put it in dictates a lot of the longevity of that product. And overall, the implants are more similar than different. So I think we focus a lot on the product when we think about these complications that are long term in terms of in breast implants, capsular contracture. I think in terms of fillers or injectable products, we think of like granulomas or lumps and bumps and things like that. And I think a lot of that is related to how it's put in. Any inflammatory response or immune responses that you can get to any of these products are probably related to bacteria that get in as you are injecting the product, that come along with that product, then sensitize that product to your immune system, and then your immune system attacks it. I think if we think in terms of like the most dangerous things, I think there's nothing that makes this different in terms of the ability for a fat embolism to happen, which is injecting it into a vessel, which is why you need to stay above the muscle and stay out of the danger zones in the buttock region. I use an ultrasound. The other like legal question in Florida is, do you need to use an ultrasound to inject this product? Well, technically, there's a law in Florida that if you're doing a BBL, you have to use an ultrasound, Florida specific. If you're fat grafting to the buttock, you need to use an ultrasound to guide that into the right plane to make sure you are not injecting it into the muscle or even worse, under the muscle where the blood vessels lie. The idea behind that is that if you create a high pressure system underneath the muscle or by injecting into the muscle, the large gluteal vessels can tear and become a very easy negative pressure system for the fat that's under high pressure because you've put, 300, 400 cc's into the buttock, and then that fat will go into that blood vessel and cause a fat embolism, which is a very dangerous, fatal, potentially complication. Now, we're not injecting these volumes into the buttock. We're injecting like 50, 100 cc's at a time. No one's injecting 300, 400 cc's at a time into the buttock. But there is a possibility that you could inject it into a blood vessel, a gluteal vessel. So I think ultrasound is important for that reason. And I do use it for every injectable Alloclae procedure I do, as if I was doing a fat grafting BBL. But I think the other component of that is getting the product into the right plane is very important for efficacy of the product. If you inject it too superficially, you are going to see like a peau d'orange. It's not going to
Yeah.
give volume. It's just going to kind of infiltrate through that superficial fat and cause a very weird looking skin appearance and not give you the volume that you did this whole G prime discussion and rheology discussion for, and it's not pushing the right structures. So this needs to go in the deeper fat layer. You have to
Right.
go through the fascia to get it. And I don't know any way to do that other than using an ultrasound,
Right.
especially in my skinny patient who has hip dips that are in. Those
Hmm.
fascial layers are like almost sandwiched perfectly together. And it's really hard to even tell that you're getting into that layer if you're using ultrasound. So doing it without ultrasound, I think allows you to waste a lot of product and then not get the result you want, and your patient's unhappy, in addition to the safety aspects that I think are less so important in terms of the amount of volumes that we're injecting. I think they're still important in terms of, yes, avoiding a deep blood vessel, but that's not even close to where we should be injecting this.
Right. And I've definitely seen that orange peel effect when injecting hyperdilute radius too superficially, and it almost looks, for lack of a better phrase, it almost looks like an alien's trying to come out of the
Right.
buttocks because it's so like irregular, and it does settle. It's not anything permanent. It's so hyperdilute that you can comfortably know that that product will over time settle, but you still don't want your patient leaving like that. So when it comes
Yeah.
to that instant gratification with Alloclae, does it take time? I know you mentioned that there's kind of a little expansion over time that you see. You have results and then it expands a little bit, but is there instant gratification? Do they walk out and have the volume, or does it take like
They
6 to 8 weeks?
it's instant. So that's
Instant.
why I
Okay.
can do this, and that's why I can do the injections and then even identify areas with that last 25% that I reserve, and I have the patient stand up and they're like, "Ooh, I like this. I like this. I want a little bit more here." And they can immediately I can just add that, and then they can we take pictures right after, and they are bruised and they're red in those areas, but it's there, the volume. And I haven't had patients report really loss of that volume yet. There's 1 year data that's come out that suggests that there's really high take over 1 year that doesn't go away because it makes sense from a mechanism standpoint. There's not fat to die. We're injecting a scaffold and the fat's populating that scaffold. I think when you will see some loss of result will be if people continue to lose weight. But I think usually at 6 weeks is when we see stabilization of the amount of fat graft that you will maintain. So the other question is if we see this expansion, will it expand forever and we'll have this huge butt? No, it's, 6 weeks is when we see it stabilize. The initial treatment, it feels a little hard to the touch. It doesn't feel like fat. And then as the fat cells populate that, it softens up. And by the end of the 6 weeks, you cannot tell the difference between that and regular fat.
What's a pearl that you incorporate every time you perform this treatment that you didn't realize in the very beginning that has actually improved your results?
Yeah, I think it's the how you numb the patient is
Okay.
really important. And numbing it in that plane makes it a lot easier for that patient to tolerate the procedure really well, especially in the hip dips, where those fascial layers are really
So
stuck
tight.
together. So I actually inject the local using ultrasound as well, so that I can hydrodissect that plane with the numbing medication that I'm using. And that makes it really easy then for me to put in the Alloclae in the right place. And that area's kind of been numbed up already. Otherwise, the stretch of those really tight fascial layers away from each other caused quite a bit of pain. And I think at the beginning I had patients that had a little more pain with this procedure, definitely required Pronox. And I think as I've evolved my techniques to actually include ultrasound in my numbing, when I'm doing the numbing tumescent, I think that has changed a lot. We talk between the high users of this product of different practices, and definitely different people do it in different ways. They offer 3 different cannula tips. They have this one more rounded cannula tip that I use for kind of generalized buttock augmentation. They have a flat tip, like a spatula tip, and I use that around the breast area and the upper pole of the breast, especially if there's a breast implant. And then they have what they call a cobra cannula, which is more of a pitchfork type cannula tip. And I actually use that in addition to Ovally, which is a cellulite band reducing device, to really just help finish that job of the Ovally and cut those bands. And I place actually a layer of the Alloclae underneath it to allow for that band to not readhere. So anytime I do Ovally, I use Alloclae as well to provide as a buffer so that it doesn't heal back down. So
So
I think your choice in cannula may have is a different pearl that I actually order specifically for the patient that's coming up.
that's fascinating. So could a patient, let's say they don't necessarily, their main focus isn't volumization, like va-va-voom, buttocks or hip dips, but they have like global cellulite. Have you seen an improvement in cellulite with this?
Yeah, certainly. I have thought a lot about cellulite, which there haven't been great treatments for. I even think the concept.
RIP to Quo.
Right, right. And there have been some good treatments that also haven't made it through. And I truly believe that cutting the band is one aspect, but then you're going to induce an inflammatory reaction there because you've caused bleeding, you've caused inflammation, you've cut that band. And I think that will allow it cause it to readhere, your body's going to create a collagen reaction, right? We have that inflammation going. It's going to cause collagen and more fibrosis of that area, and it's going to just readhere, maybe even stronger. This is my theoretical thought of how this works. So I love the idea of having a spacer in between after you cut that band to prevent that from readhering.
So, numbing techniques and cannula choice have really elevated your results since you started offering this treatment.
Yeah, and I think also adding the right amount of volume and being conservative, but not saying we're going to do a little bit for a subtle result. You have to, as with everything, give your patients proper expectation management about this. They are going to have a expensive quote because the product is expensive itself to the provider, and that's for the safety. And I explain why that's the case, why this product is expensive. It's expensive to create by the companies. And then I also tell them that if they try to just do a little bit because they're cost conscious, they're not going to be happy with their investment of that little bit as well as the result, and they will never want to do more. So I started out trying to do smaller areas and saying, hey, we'll add a little bit more, we'll add a little bit more. And pretty much now my minimum order is about 100 cc's because I'm treating one area on each buttock. Sometimes I'll order a little less if we're doing something in the breast, like trying to fix a contour regularity, or if some patient comes in with rippling from something or has some small asymmetry, I will do less. But even in the breast, I say, okay, we're going to use 100 cc's to create symmetry if there's asymmetry, and then the next 100 cc's we do is going to be for volume. So I'm usually going at 100 cc increments, which is not cheap, but I think gives a meaningful result without going over the top and overfilling them for things that they don't need. They can always come back for a second treatment.
I always like to use the analogy when I'm speaking to patients, like on a smaller scale for jawline contouring. When I first started out, I'd be like, they'd come in with a 1 syringe budget, and I'd be like, okay, let's try it. And I quickly realized that that was just setting myself up for failure, right? And I always use the analogy, I can't paint this entire room with just 1 gallon of paint. I can't complete the project. So I'm going to leave disappointed, and you're going to leave disappointed in your results. So in terms of pricing range, how does it compare to surgery versus hyperdilute radius and Sculptra? Where does it sit?
Great question. So if we think about for buttocks, what a surgical procedure would be, you're doing liposuction, you're doing the fat grafting element, there's an anesthesia cost and the surgery cost that, gets pretty reasonably high if you're doing it in a kind of safe manner. This is not counting, basement BBLs that are being done. This is doing in like an accredited way with properly trained surgeons. That's not going to be cheap. I mean, that'll be in the $10,000 to $20,000 range to get that treatment done. I think if we think about the hyperdilute radius Sculptra, we're talking about that $6,000, $8,000, $10,000 range 3 times a year with maybe a minimal result. And I think Alloclae falls in that kind of 10 to 15 per treatment, price point, depending on how much product you're getting at a time.
Right.
I think the difference between the surgical result and the Alloclae is also the downtime that you have. So you have to consider the time off from work. I don't know anybody who's able to get a BBL and go back to work the next day if they're sitting, if they have sitting restrictions and they have to remain prone, or they can't fly back, or they can't drive back easily. There's a lot of time off from work and recovery aspects just to see if you can get the fat to survive. With Alloclae, you can go back to work that same day potentially, right?
You can even sit on it.
You can sit on it, you can sleep on it. You're not going to kill the fat cells. Wow. They're not alive to begin with. So you do not have this recovery period that I think you have to think about, the economic recovery from some of the surgical procedures, which are time away from work, getting childcare, potentially figuring out how to travel back and forth, or stay in a hotel with a nurse, garments, compression. All these things are a lot which you don't really have to do with Alloclae. So I think it ends up being cheaper than all of that added together because of the pure convenience aspect of it. Now, at certain volumes, then it becomes more expensive.
Sure.
Right? And I mostly tell patients this in the breast category because a lot of times they're asking me, well, can I do an Alloclae breast augmentation instead of an implant? And at some point, depending on the size that you want and the amount of Alloclae you need, it will be cheaper to get a breast augmentation.
Right.
But a lot of my patients who are doing explants but still want volume or just want a little bit of a boost, that's their only option. I think giving more options to your patients is great, but the economics have to make sense. Breast implants aren't charged by volume, so if you need bigger volume, it doesn't cost you more. For
Right.
Alloclae and other filler type treatments, they are charged by volume, so we have that reality to live with.
I think a good surgeon will just sit down and weigh out the pros and cons to all of them. And I'm sure it's a patient by patient case basis that you determine what ultimately will be best for them, especially what their expectation is and what they're hoping their outcome is. I'm sure at some point you're like, well, maybe surgery is a better option for you versus Alloclae. But I walked into this conversation, like I said, with very little knowledge about this product, and I am so excited to see and watch how it just evolves over time. I appreciate you so much taking the time out to educate me, educate whoever's watching, because I think it's so important to get solid education out there versus we get on TikTok and we see all these influencers posting about things and they so much misinformation gets spread so quickly on things that I think having really strong conversations like this is so needed in our industry.